you are 25 weeks pregnant, you probably have a lot of questions like how your baby is developing, what you should expect at your next appointment, and when you should start thinking about prenatal classes. And we're going to talk about all of that and more right now. But first, if you're new here, you're watching the Health and Medical Zone. And if you're new, the Health and Medical Zone means being in good health and good spirit. So if you like being healthy and being happy, go ahead and click subscribe because you're definitely in the right place. So at 25 weeks pregnant, you are 6 months and 1 week along, and you have about 15 weeks left to go. Your baby weighs around 1.5 pounds right now. Their crown rump length, which means from the top of their head to their bottom, is almost 9 inches. And from head to toe, your baby is about 12.5 inches long, so just over a foot tall. Now, keep in mind that every baby grows at a different rate. These measurements are just averages, so your baby might be a little bigger or a little smaller, and that is completely normal. Earlier in your baby's development, the liver was the main producer of red blood cells. But now, at 25 weeks, the bone marrow has taken over as the primary site for red blood cell production. Your baby's sense of smell has developed, and they can actually smell flavors in the amniotic fluid. They're also beginning to develop a sense of equilibrium, meaning they can start to sense up and down. Over the next few weeks, your baby will usually start to make their way into a head-down position. And if they don't, that's okay. It doesn't mean they don't have a good sense of equilibrium, it just means your baby is what we call breech. At 25 weeks, you'll notice more and more movement, and you'll start to see a sleep-wake cycle develop. Your baby won't be moving all day and all night. Instead, you'll begin to notice patterns. And it's completely okay if there are long stretches of time when you're not feeling movement. When you're up and walking around, that motion often rocks the baby to sleep. And when you lie down, that's usually when the baby becomes more active and awake. There may be times when you're exhausted and just want to sleep, but your baby has other plans. Even though it can be tiring, it can also be a really special time to enjoy feeling those movements without all the distractions of the day. If your significant other is in bed with you, this is also a great opportunity for them to feel the baby move if they're patient enough. At 25 weeks, your baby is laying down more and more fat, which means they're starting to really fill out and look a bit plumper. If you've been thinking about getting a 3D ultrasound, this is a great time to do it, in my opinion. Your baby is filling out and looking more like a newborn, but they're not so big or so cramped in the uterus that it's hard to get a good image. So now through about 30 weeks is an ideal window for a 3D ultrasound. Now, if your baby were to be born at 25 weeks, they would have about a 75% chance of survival. However, there is still a high risk of severe disability, and they would need to stay in the neonatal intensive care unit for quite some time, usually at least a few months. Because of this, your OB will do everything possible to prevent delivery this early. That being said, let's talk about the symptoms of preterm labor versus Braxton Hicks contractions. Braxton Hicks contractions are often called practice contractions. They're considered normal, and they don't mean that you're going to go into labor early. This is simply your body's way of preparing for labor. If you haven't noticed any yet, that's totally fine, there's no reason to worry. But if you do feel them, they usually feel like a tightening of the muscles in the uterus. During a Braxton Hicks contraction, your belly may feel really hard. They're not painful, but they can feel a little uncomfortable because of the tightness. When it comes to timing, they're unpredictable and irregular. They don't follow a pattern, and they don't become stronger or more frequent over time. Real contractions are different. They tend to come at regular intervals, and they usually become stronger and more frequent as time goes on. So to summarize, Braxton Hicks contractions are irregular, don't have a predictable pattern, and don't increase in strength or frequency over time. Real contractions, on the other hand, are regular and become more intense and closer together. Another important difference is that Braxton Hicks contractions don't come with other symptoms, like a gush of fluid or vaginal bleeding. If you experience any of those symptoms, you need to call your OB right away. And if you're ever unsure, call your OB anyway, that's exactly what they're there for. There are tests your provider can do to help determine whether you're experiencing preterm labor or just Braxton Hicks contractions. In the office, they can check your cervix to see if it's dilating or thinning. They can also use an ultrasound to measure the length of your cervix and track whether it's shortening over time. There's also a lab test called FFN, or fetal fibronectin. FFN is a protein produced by fetal cells, and it's thought to act like a kind of biological glue that helps keep the fetal sac attached to the uterine lining. The FFN test is done with a cervical swab and helps predict the likelihood of going into labor within the next 1 to 2 weeks. If your FFN test is negative, that means you have less than a 5% chance of delivering in the next 2 weeks. As for you, by 25 weeks, women gain an average of about 15 to 18 pounds. Your belly is definitely getting bigger, around the size of a soccer ball by now. It's big, but usually not quite big enough to be in your way too much, at least not yet. This is a great time to start getting things ready for the baby. One thing you may notice yourself doing sometimes without even realizing it is nesting. This is that natural instinct to prepare your home for your baby. So if you suddenly feel the urge to reorganize, deep clean, or do some baby shopping, that's completely normal. Enjoy it and take advantage of this time while you're still feeling good. Let's talk for a moment about maternity clothes. Some of you might just now be starting to need them. Others may have been wearing maternity clothes since week 6. Either way, it's all totally normal. But at this point, just about everyone needs to give in and buy some maternity clothes, because you're not going to be getting any smaller anytime soon. So here's a little advice from someone who's been through this 4 times. Don't go overboard, but do invest in multifunctional pregnancy clothes. By that, I mean clothes you can wear now and continue to wear after the pregnancy is over. Because for most women, you don't walk out of the hospital in your favorite pre-pregnancy jeans. I wish, but that's just not how it usually works. Thankfully, there are some great companies out there that understand this and design maternity clothing with that in mind, because it does take time for your body to return to your pre-baby size. Now, for those of you who choose to bottle feed, that is completely fine. And thank you for taking such great care of your baby. And for those of you who are nursing, sometimes breastfeeding helps with weight loss, and sometimes women don't lose the baby weight until they stop nursing. Everyone's body responds differently. Your OB will likely want to screen you for gestational diabetes. This is a type of diabetes that occurs only during pregnancy and typically goes away after you deliver your baby. The screening is a blood test that's done after you drink a very sugary beverage, and it helps determine how well your body is able to control your blood sugar levels. Your OB will give you the sugary drink to consume before or during your appointment. Then they'll check your blood sugar to see how your body handles that sugar. If your blood sugar levels look good, you pass the test and you do not have gestational diabetes. If your blood sugar levels are elevated, they'll have you come back for additional testing to determine whether you have gestational diabetes. If you do, your OB will usually recommend a special diet to help control your blood sugars, or in some cases, insulin injections may be needed. Either way, it's very important to keep your blood sugars well controlled during pregnancy. High blood sugar levels can cause your baby to grow too large, which can make vaginal delivery more difficult. After birth, babies can also experience low blood sugar levels. Having gestational diabetes does not mean that you will have diabetes after your baby is born. However, studies do show that women who have gestational diabetes have a higher risk of developing type 2 diabetes later in life, so it's something to be aware of moving forward. When your OB checks your blood sugars, they will often also order a CBC, or complete blood count, to screen for anemia. Anemia is fairly common during pregnancy, so common, in fact, that most prenatal vitamins already contain iron to help maintain healthy iron levels. If you're still anemic despite taking prenatal vitamins, your OB may recommend an additional iron supplement. Keep in mind that iron supplements can cause constipation, so if you are taking extra iron, be sure to include plenty of fiber in your diet to help prevent constipation. One last note: at 24 weeks, the survival rate for babies born prematurely doubles. increasing from around 33% to about 60%. That means more than half of babies born at 24 weeks can survive. Thank you so much for watching.